Testing. If I go, take your right knee up towards your chest, this PSIS should drop down. That test flexion. Okay. Then when I get them to move this leg up, that S2 should drop down, and that's extension.
So it's like this.
Yeah. That one rolls backwards like that. Okay, and the sacrum should drop down.
So
okay.
flex and sacrum. Sacrum it will be flexed.
Yeah, so we're flexing this leg to try and get that sacrum to drop down. Okay, and it didn't drop down. Okay, they've got an extension restriction. So then the way I adjust that is I get them laying down there. Because I'm still on this side. That S2 didn't drop down when I got them to flex that here. So now I'm making them, I want that S2 to drop down. So I'm going to flex the patients here. Yeah. Okay, the weight of the body is keeping that ilium stuck. Okay, because the patient's leaving their body weight's on that, that's not moving. Sacrum is dropping down like this. So I do this. And then I roll the patient. Okay, and then my line of drive is to that ASIS. As my legs drop down, that is going to get that S2 to drop down.
Create this bone like this.
This bit and the sacrum with it to go down like that. Because
the second
yeah, medial to the PSIS.
But why you call it extension? It looks like a flexion, right?
It's flexion of the
sacrum.
Yes, essentially, yes. Because when Chris
we can do it.
It's going like that.
Extension sequence like this.
对啊，那这里写的是 extension， 但是他做的是 flexion， 你不觉得吗？这是为什么呢？
When we tested it, it didn't do it. When we got them to lift their other leg, it didn't drop down.
So why?
So when Chris talked about Gillet's test, when we talk about this one dropping down, that's extension of the ilium, but it's flexion of the sacrum because the sacrum.
And the anterior.
As this one goes like that, that does that. So it's flexion of the sacrum with that test.
And the extension of
the technically is like flexion.
Because so then when we do extension of the sacrum, we're using the opposite side here, which is then doing that. That's extension of the sacrum. Does that make sense?
Good. I see.
Yeah. Yes.
So and for the anterior technique is like
for the flexion, do you mean?
Yeah, for the flexion.
Yeah.
So it's for the extension we do it like this. And the flexion, I think is like.
It helps for me. It helps if I don't think about the sacrum. If I just think about the ilium, then it makes it easier.
Extension.
So even though it's extension of the ilium, we're testing flexion of the SI joint. Because it's relative to the sacrum. So just think that when you did your Gillet's testing, this one didn't drop down. Okay? So for a flexion adjustment, I'm going to make it drop down. That was the first one we just did today. Okay, so if you hold that one there for me. Okay, I then flex the patient's hip like this. Okay, my contact is on here, but it's mostly my legs driving this, where I'm dropping forward like that. This did not drop down when I did Gillet's. I want to make it drop down. Okay, it's meant to drop down. So that's flexion.
Flexion.
Yes.
So flexion contact point.
That's the flexion. Yes, correct. So that's our flexion adjustment.
Looks like an extension.
It is extension of the ilium, but it's flexion of the sacrum.
So
when the ilium does that, the sacrum goes into flexion.
So all this is about sacrum extension. And, oh my God. Okay.
Yes. Even though we're using the ilium as the reference point, it's silly.
Okay. I got it.
So then for extension, when we tested it. So if it was this side here, I've got my patient, so there's my flexion, do your right knee up towards your chest, great, that dropped down. Do your left knee up towards your chest, doesn't drop down. So I'm going to make it, right? I'm going to use your left leg and I'm going to make that S2 drop down. So I do my flexion, like I flex the hip through here, okay, I roll the patient as a unit, and in my adjustment, don't contact my hand here, but what I'm trying to get happening is this. Because I want that S2 to drop downwards.
So for me, personally, I think for the extension technique, we help it pelvic bone and the sacrum, and the flexion will only help it. We only flex the pelvic bone.
So when we do flexion, when we do flexion adjustment, we're contacting the ilium.
Yeah, sure.
We're moving the ilium into extension of the ilium,
And
but it's flexion of the sacrum.
We don't flex or extend the sacrum. We keep the sacrum at
We're keeping the ilium fixed because the patient's body weight is stuck on that, and then I'm moving that sacrum into extension via a sacral contact. Does that make sense?
So basically, it's like move this one to adjust ilium, right?
Yeah, so for flexion, I'm moving the ilium into extension to get the sacrum to move into flexion.
Okay.
Yeah?
Okay. I know. Yeah,
that makes sense.
So the flexion, the force is like this.
Well, yeah, but remember, this isn't doing anything. It's 10%. It's a trigger adjustment. It's the legs doing the carver bridge that's doing most of the work. Okay? 90% legs, 10% head. To get the ilium to drop down like that. Okay? Which is technically extension of the ilium. Because that movement is extension of the ilium. But it's flexion of the sacrum. So we talk about it as flexion of the sacroiliac.
Sacroiliac. Okay.
Yeah.